my name's Maddie. I'll be your nurse today, and I'm going to be doing a head-to-toe assessment.
Okay.
Just before we get started, I need to make sure I have all my equipment. I have my stethoscope, I have my gloves, I have my pen light, I have my hand sanitizer, and my alcohol swabs. I'm going to perform infection control with my alcohol swabs. And my hand sanitizer for hand hygiene. Before we get started, do you have any assistive devices that you use?
No.
Okay, and if you have any pain throughout this assessment, please let me know, okay?
Okay.
So, your name?
Hannah.
And where are you?
Old Orchard Beach.
And what's the day today?
Saturday.
Okay, patient is alert and oriented ×3. Clear speech, not slurred. Level of consciousness is appropriate. Able to respond to questions. So I have 3 words for you to remember. I'm going to ask you them at the end of the assessment. The 3 words are sun, dog, and tree.
Sun, dog, tree.
Awesome, thank you. And to assess your cranial nerves, I'd like you to smile, frown, puff out your cheeks, and raise your eyebrows. Okay, so patient's cranial nerves are intact and able to respond to commands. And now to assess your fine motor skills, I'd like you to touch your fingers to your thumbs. Okay, patient's fine motor skills are intact. And now to assess your sensations, I am going to ask you to close your eyes, and I'm going to touch each part of your body, and you can tell me where I touched, okay?
Okay. Right foot. Left hand. Chin. Left foot.
Okay, patient sensations are intact. Patient was able to differentiate between upper and lower extremities and also the face. So I'd like you to stand up, and I'm going to assess your gait. Okay, if you could walk over there and back. Okay, patient's gait was normal, no swaying or limping, no abnormal balance or coordination. Now, could you stand on one foot and the other? Patient's balance and coordination are intact. And now if you could bend over, I'm going to assess your spine. Okay, upon palpation, no masses or lesions, no curvature of the spine, no signs of scoliosis, kyphosis, or lordosis. Posture is erect. And now we're going to do range of motion on the upper extremities. So we can start by doing strength. If you could push up on the hands and push down. Okay, patient strength is 5 out of 5 on both sides. And now for your shoulder, I'd like you to move your arm in a circular motion. No signs of crepitus, any pain? Nope. And for your elbow, no signs of crepitus, any pain? Nope. For your wrist, no signs of crepitus, any pain? Nope. Okay. And also the same this side. No sign of crepitus, any pain? Nope. And elbow. No signs of crepitus, any pain? Nope. Okay. Same for wrist. No signs of crepitus, any pain? Nope. Okay. Skin on the upper extremities is pink, warm, and dry to the touch. And now I'm going to look at your hands. Upon palpation, no abnormal masses or lesions. Capillary refill is under 30 seconds. Nails are also intact. Skin turgor is good, no tenting, no signs of dehydration. And now I'm going to assess the radial pulses. Radial pulses are both 2+ in strength, equal bilaterally, no abnormal rates or rhythms. And now for the lower extremity range of motion, I'd like you to move your leg forward. Okay, no signs of crepitus, any pain? Nope. And for your knee, please bend. No signs of crepitus, any pain? Nope. Same with this side. No signs of crepitus, any pain? Nope. And for your knee? No signs of crepitus, any pain? Nope. Okay. Now I'd like you to sit down so I can assess the head and neck. So Head is placed appropriate on body, good size and shape. Skin appears dry, pink, and warm to the touch. And now I'm going to put on gloves to assess your scalp. So hair is evenly distributed, no signs of critters, texture of hair is good, and no palpable masses or lesions in the scalp. Hand hygiene. Okay, so neck is erect and midline, trachea is also midline, and could you please swallow? Okay, thyroid is not palpable, no signs of goiter. I'm going to assess your sinuses, your frontal and your maxillary, and also your lymph nodes after. If you have any pressure in your sinuses, please let me know.
Nope.
Okay, patient has no pressure in the sinuses, no sign of infection. Lymph nodes are not palpable, no hardening, no swelling, no sign of infection. Okay, so now to assess your spinal accessory nerves, I'm going to ask you to raise your shoulders upward. Okay, spinal accessory nerves are intact. Now, I'm going to test for TMJ. Please open your mouth. No crepitus, any pain?
Nope.
Okay. Now we're going to do range of motion of your neck, head down, and back, inside, inside. Okay. Patient did not report any pain during range of motion exercises. Now I'm going to assess your ears. No palpable lesions or masses on your ears. And I'm going to assess for drainage. No drainage. Okay. And there's no rashes or no palpable nodules, and no reddening of the skin or ears. Now I'm going to perform the whisper test, and I'm going to whisper a word into each ear, and you're going to recall them, okay?
Mm-hmm.
Dog. Cat. Patient was able to perform whisper test and pass. Patient does not have any difficulty hearing. Now I'm going to assess your eyes. Your sclera is white. No signs of jaundice. Your eyebrows and your eyelashes are appropriate. No edema of the eyelids, and your cornea is clear. Your iris is blue, and round. Pupil is 4 millimeters in size. Eyes are symmetrical, and size and shape are appropriate. Your conjunctiva is pink and no signs of discharge. I'm going to perform the cardinal gaze test. I'm going to ask you to follow my pen light with your eyes. Patient's nerves are intact. Patient was able to follow pen light with eyes. And now I'm going to test for your peripheral vision. Please let me know when you see my hands, okay?
Yep.
Okay, patient's peripheral vision is intact. And now I'm going to test your pupils with my pen light. Patient's pupils are equal, round, and reactive to light. Now for accommodation, I'm going to take my pen light and move it into your face. Okay, pupils are consensual, constricted, bilaterally accommodation. And now for your nose, appropriate in size for your shape, no visible abnormalities. Do you have any difficulty smelling?
Nope.
Okay, so I would like you to take one finger and put on your nostril and inhale, and the other nostril. Okay, nostrils are clear both bilaterally. I'm going to assess for drainage. no drainage present, and no sign of a deviated septum. Your mouth is appropriate size for your body. Your lips are pink and moist. And keep these open. Okay, uvula is midline, tonsils are intact, mucous membranes are pink and moist. Teeth are healthy, no signs of plaque. Tongue is appropriate size and shape, it does not deviate to one side, and there's no odor. Also, no sign of cyanosis. And your skin on your face is warm and dry to the touch. Now, I'd like you to lean back so I can inspect the precordium. Okay, no signs of a flutter, no signs of heaving, and no difficulty breathing. I'm going to listen to your heart sounds. Also going to use my bell to listen. Okay. No abnormal rate or rhythm, no whooshing sounds. S1 and S2 were present, which means your mitral and tricuspid valves are working correctly. I'm going to feel for your carotid pulses. Pulses are +2 equal in strength, both bilaterally. And I'm going to listen to them. Use my bell also. No signs of roots or whooshing. Rates are both 2+ in strength, both bilaterally. No abnormal rate or rhythm. Now I'd like you to stand up so I can check your lung expansion. Take a deep breath. Exhale. Okay, patient's lungs were able to inspire equally. No barreling of chest, lungs inflated both bilaterally and symmetrically. And now I'm going to listen to your lung sounds. Take a deep breath in. And deep breath on the side. Okay, thank you. Lung sounds are present, equal both bilaterally, no crackles present, no sounds of bronchi or wheezing were present. Do you remember the 3 words I asked for earlier?
Dog, tree, and sun.
Awesome. So patient's short-term memory is intact. Patient was able to recall words when I asked for them from prior, in the beginning of the assessment. So if you could lie down, I'd like to assess your abdominal sounds. So upon inspection, patient's skin is warm, pink, and dry to the touch. I'm going to listen now in all 4 quadrants. Okay, no signs of hyperactivity or hypoactivity. We'll listen to your aorta. No signs of an aortic aneurysm. Okay, now I'm going to palpate, and if at any time you have any pain, please let me know, okay? Okay. Patient does not report any sign of pain. Skin is pink, warm, and dry to the touch. So now I'm going to do range of motion of your lower extremities. We can start by strength, so please push up and push down. Strength is 5 out of 5, both bilaterally. Nails are intact. Capillary refill is under 3 seconds. Skin turgor is good. No signs of dehydration. And now I'd like you to move your ankles in a circular motion. No signs of crepitus, any pain?
Nope.
And spread your toes apart. Okay. Now I'm going to listen to 2 pulses. First one I'm going to listen to is your dorsal medialis. Okay. Pulse is +2 in strength, equal bilaterally, no abnormal rate or rhythm. And now your posterior tibialis. Okay, +2 in strength, both bilaterally, equal and symmetrical. No abnormal rate or rhythm. And skin of the lower extremities is pink, warm, and dry to the touch. That will conclude our health assessment video for today.